Dr. Boyd was one of the first doctors that had an office here in the city of Pasadena. He came here in 1921 and he worked for Crown.
Although Dr. Boyd was the company physician for Crown Petroleum, his job there apparently did not keep him that busy because he immediately went into practice. He opened an office originally out of his home on Main Street, and then later he rented the half of the downstairs of the Masonic building for an office. It meant a lot for Pasadena to have a full-time doctor because they weren't dependent on a doctor from Harrisburg or LaPorte taking care of them. They didn't have to travel all the way to Harrisburg, 8 miles away, in LaPorte, which was a little further away. At the time that Dr. Boyd came to Pasadena in 1921, this was largely a rural community. It was a community of farmers, primarily strawberry farmers, but they also grew other crops. It was a very low-tech medical community because there was no hospital here. There were no x-ray facilities, no laboratory facilities. Most of the residents had their children delivered at home either by a local doctor or doctor and a midwife. There was a hospital in Harrisburg that was 8 miles away, but those facilities were not readily available here.
He had a buggy and a horse, and he went in his buggy.
Roads were unpaved, and you can imagine how difficult it would be to get out to some farm to deliver a baby in the middle of the night when it had been raining and the roads were fairly impassable.
He always took his medicine with him. He had a little black case, and wherever he went, he carried that medicine with him, and that way you didn't, there wasn't a drugstore in every corner then, so he could immediately give them treatment right there when he went to their homes.
It's interesting to note that Dr. Boyd often prescribed a shot of whiskey.
Give you 2 tablespoons of alcohol in the morning, 2 tablespoons at lunch, and then 2 tablespoons at night.
Since Prohibition was in effect in the 1920s, it was legal to prescribe whiskey for medicinal purposes, and Dr. Boyd often prescribed a pint of whiskey. His prescriptions were filled as far away as downtown Houston, which makes somebody think that maybe all of these prescriptions were not actually medicinal.
He must have carried a lot of alcohol around with him.
Also, there was a limit on medications. There were no antibiotics. If the doctor diagnosed pneumonia, he didn't have an x-ray to confirm his diagnosis, and he didn't have antibiotics to treat the pneumonia. There were other methods to treat pneumonia, but they were far short of what we have today. And pneumonia was a very dangerous disease in those times. Dr. Boyd caught pneumonia when he was out delivering a baby in the middle of the night in 1927. He did not recover from this pneumonia and he died.
We should remember him because being one of the first doctors to set up here, we only had one other doctor before him and he only stayed 5 years, so he was a very good doctor and people liked him a lot, and he traveled around and took care of the people. I just think he was a very good man. We should preserve the history of Pasadena because this is our heritage. We want our children to know what was before them.